Foreign body retrieval is a medical procedure used to locate and remove objects that have been accidentally swallowed or inserted into the gastrointestinal tract. This procedure involves using an endoscope to visualize the foreign object in real time, followed by the use of specialized tools to grasp and safely remove it from the GI tract. Some examples of foreign body retrieval are shown here. However, what if I told you that one of these procedures is actually being performed on a completely synthetic GI tract? That's right, this recording was taken on a synthetic GI tract created completely by our Capstone team. To see how we got here, we have to rewind 3 months to the beginning of the semester. Our group was initially retained by Actuated Medical to evaluate the effectiveness of their FDA-approved device, the GripTract. This device is currently approved for tissue manipulation during gastrointestinal procedures. We wanted to explore a new question. Could the GripTract also be used to retrieve foreign bodies from the GI tract? To answer this, we needed a realistic testing setup. Since no suitable products currently exist in the market, we decided to develop our own synthetic GI tract simulator. Our journey began with interviews. We spoke to a wide range of clinicians involved in foreign body retrieval. At the same time, we performed a patent search and reviewed existing literature to better understand GI tract models. Based on what we learned, we developed a list of specifications and desired performance metrics that would help us evaluate the GripTract. Next, each team member brainstormed ideas, and we ended up with over 40 different concepts. We then moved into alpha prototyping, focusing on form and materials. We found that a tunnel-style design was the most accurate and durable approach, especially compared to simpler tube models. We made our first prototype by taking a scaled-down 3D model of the stomach, placing it in a container, and simply pouring silicone over it to create a flexible, realistic form. In the beta prototyping phase, our challenge was to make the tunnel system easily accessible for inserting and retrieving foreign objects. We solved this by creating the model in 2 silicone halves that could be opened then resecured after each use. To make that work, we allowed the first layer of silicone to cure, applied a release barrier using petroleum jelly and anti-stick spray, then poured a second layer on top. This allowed us to separate the 2 halves cleanly. With the process refined, we moved on to a full-scale version. We designed the model in SolidWorks, printed it in 8 sections, and glued them together. Then, we repeated the silicone pouring process, this time using 6 gallons of silicone dyed to simulate the natural color of the intestines. We also built a custom containment frame from 2x4s to help reduce silicone waste and match the model's unique geometry. Dowel rods were inserted to help align and secure the 2 halves. For extra alignment support, we cut a 1/4-inch sheet of acrylic and fused acrylic prisms at key flex points to improve fit and stability. Finally, we had our completely synthetic GI tract, a 3-part system including a frame, bottom half of silicone, and top half of silicone, all secured using dowel rods. We then validated our model using an endoscope and the GripTract device provided by Actuated Medical. Upon verification, we met our desired metrics for repeatability, ease of use, cost-effectiveness, and anatomical accuracy. However, we had to make a few compromises on physical properties to protect the model from interface impaction. In the end, we successfully created a realistic GI tract simulator that can be used to evaluate the GripTract's capabilities and serve as a valuable teaching tool for clinicians.